Up next, Authentically Detroit continues its return to the Mack series with AP's National Race and Ethnicity reporter Kat Stafford. We also talked to the newly appointed CEO of the Children's Center, Nicole Stallworth, and the Workforce Intelligence Agency, and the first woman to be the editorial page editor for the Detroit Free Press, Nancy Kaffer. Authentically Detroit starts after these messages.
Founded in 2021, the Stoudemire is a membership-based community recreation and wellness center centrally located on the east side of Detroit. Membership in the Stoudemire is available on a sliding scale for up to $20 per year or 20 hours of volunteer time. The Stoudemire offers art, dance, and fitness classes, community meetings and events, resource fairs, pop-up events, the neighborhood tech hub, and more. Members who are residents of the east side have access to exclusive services in the Wellness Network. Join today and live well, play well, be well. Visit ecndetroit.org.
Bridge Detroit is your news and engagement platform that is telling the stories of Detroiters rooted by community priorities. Started in 2020 by Pulitzer Prize-winning journalist Stephen Henderson, the newsroom has already established its footing as the go-to source for hyper-local perspectives that ask the hard questions, brings accountability, and searches out real solutions. It's free to become a member of this award-winning news organization. Visit bridgedetroit.com today to sign up to receive the news delivered right to your inbox. Bridge Detroit, by Detroiters, for Detroiters.
Hey, y'all, it's Orlando. We just want to let you know that the views and opinions expressed during this podcast episode are those of the co-hosts and guests and not their sponsoring institutions. Now, let's start the show.
This is the Authentically Detroit podcast, broadcasting live from the beautiful Grand Hotel on Mackinac Island at the Detroit Regional Chamber's Policy Conference. I am sitting with AP, race and ethnicity reporter, friend to the show, the unofficial co-host, unofficial third host of Authentically Detroit. We used to say it all the time because we used to have her on all the time. Kat Stafford.
Hi, everybody.
Kat, it's really good to see you. It's been a while. Kat, you outside.
It's good to be back.
So you didn't went and had kids. You've been working. How are you approaching this moment? Right? How is this moment finding you?
It's a lot, I feel like I've spent a lot of time reporting, working, but to have some time to myself to focus on my family has been just amazing.
I love it. So we're here on Mackinac Island. It's beautiful. It smells bad, but it looks pretty. And, the theme of the conference is the power of and. So just tell me, I know this is your second time here. How is the gathering? How is this atmosphere hitting you in your body?
Well, for me, I hosted a panel conversation with the Lieutenant Governor this morning, and it was focused on inclusive policymaking. And if I could be frank, this is a conversation that I feel like would not have happened not that long ago at the conference. So to have a conference where we can actually talk about the role of structural racism, the impact it's had on our community, I think it's important, and I'm glad to see that occur.
Yeah, it is good. Listen, so you recently released a huge body of work with the Associated Press. That's what I mean when I say AP, y'all. That's the Associated Press, so she's fancy. From birth to death, right? And it's narrative. It is hard hitting. It is statistical. It is research. It's masterful storytelling. So I want to read for our listeners just a little bit of the headers, okay? From birth to death, Black Americans fare worse in measures of health compared to their white counterparts. They have higher rates of infant and maternal mortality, higher incidence of asthma during childhood, more difficulty treating mental health as teens, and greater rates of high blood pressure, Alzheimer's disease, and other illnesses. The Associated Press spent the past year exploring how the legacy of racism in America has laid the foundation for health inequities that Black people face. So from birth to death, Black American and a lifetime of disparities, right? Kat Stafford. Okay, so here's some of the quotes, right? Or some of the headers. Why do so many Black women die in pregnancy? One reason, doctors don't take them seriously. Here's a stat. 14.8% of black infants were born prematurely in 2021. Black babies were born prematurely more than any other racial or ethnic group. Here's another stat. Black children are more likely to have asthma. A lot comes down to where they live. 12.3% of black children suffer from asthma. Black children are twice as likely to suffer from asthma compared to white children. Here's another one. Black kids face racism before they even start school. It's driving a major mental health crisis. Really want to talk to you about that one. So 18% of black youth said they were exposed to racial trauma often or very often in their life. 50% experience moderate to severe symptoms of depression. Also, high blood pressure plagues many black Americans combined with COVID. It's catastrophic. 75% of African Americans are likely to develop high blood pressure by age 55. High blood pressure was listed as a contributing factor to over 20% of COVID deaths of black people. And finally, a lifetime of racism makes Alzheimer's more prevalent in black Americans. 14% of black Americans over the age of 65 have Alzheimer's compared to 10% of white people. By 2060, cases expected to increase fourfold. Kat Stafford, you spent a year working on this. How did this even get started?
So I spent a year working on a project, but really this was an idea that I've had for a long time because growing up in Detroit, I've watched family members, friends, just a lot of people deal with these issues that we reported in this project. I've seen it firsthand. I've experienced it. I had asthma growing up as a child in the city of Detroit. So using my lived experience and then combining that with all of the reporting that I did during the pandemic, seeing folks blame black folks essentially for dying without factoring in why we got to the point that the pandemic was impacting us. It gave me this idea to pursue a project that could just show how from birth to death, things that we experience before we even take our first breath really set the stage for a lifetime of potential health disparities.
And so what you're getting at is an acknowledgement of structures and institutions more than, personal behavior, because black folks would be led to believe that it is our personal behavior and choices that contribute to these kinds of outcomes and disparities that you are talking about. But what you essentially point out is there are structures in place that keep these stats really cyclical.
Yes, and really just looking at this history of structural racism dating all the way back to slavery, this foundational thing that we have been forced to experience, the oppression that black Americans have experienced really created these conditions that lead us to today where we see these disparities. It's easy to say, well, black people are more likely to have cardiovascular issues or to be obese, but it's a lot harder to acknowledge how structural racism, redlining, and all of these things have a direct impact as to why that is.
Yeah, I remember, it's so crazy. I remember you and I having a conversation right when COVID hit. And COVID hit really hard in the city of Detroit. And one of the things that you just sort of knew innately in some of the data that was coming in was validating what you already knew, is that black people were dying. And black people were dying at a disproportionate rate, especially in the city of Detroit. And you sort of set the stage for why that was. Talk a little bit about being in this industry and being sometimes the only one in the room that's saying, hey, listen, this is what's happening. I know, pay attention.
It's hard because you are isolated, you are alone, but you have to push because this is the truth. This is fact-based reporting. These aren't just personal feelings or anecdotes. This is something that has happened to generations of black Americans, and I just felt it was important to have someone like me tell this story, but it was also important to make sure that the voices that we had in the story were folks that were impacted, but not just the ones being impacted. It was also important for us to highlight black doctors, black historians, black experts and advocates. All of those voices came together to create this very powerful project, I think.
Yeah, you introduced a term to me that I've not stopped using since you introduced it, called equitable sourcing, right? Really looking at who we as journalists choose to source expertise and two, right? And oftentimes we use a ton of researchers, we use doctors, we use a lot of academics, but those folks don't always look like us. I want you to talk a little bit about, earlier on your panel with the Lieutenant Governor, you talked a little bit about, growing up on the East Side and experiencing a lot of the disparities firsthand. Talk about why having that duality of being impacted and also being a storyteller is something that we should embrace as readers, but also as a journalism industry.
As journalists, we're taught that we're never supposed to be the story or become part of the story, but I think that our lived experiences help us to tell those stories. And using my personal experience, it informed the reporting. Being someone who had asthma as a child, it helped me ask the right questions. I knew what to ask. I knew what those families were feeling. So when I went to the experts, the doctors, it helped those interviews too. So I would say bringing my full self, my full perspective into the reporting was crucial in creating what we were able to create. Without that, it was just going to be any typical story, but being a black woman, being a black journalist in America, it created this just very powerful storytelling.
Well, let's get into it, because I know that this subject is close to your heart, probably because you are a wife, but not only are you a wife, you're a mother. You are a mother. And so you set it up on the homepage, why do so many black women die in pregnancy? What have you found, and did you experience, even in your pregnancies, some of what is highlighted in the stories about black women essentially not being listened to?
I think every black woman has their own story, has a story that their sister, their mom, or someone in their life, a friend, has told them about not being listened to. And we know that could lead to disastrous impacts, including death. And so I felt that this story was important to tell because this lays the foundation. How you enter this world as a black person sets you up for what you experience throughout life. So if you're born prematurely, which black babies are most likely to be born prematurely, that sets you up for asthma, respiratory issues, and so on and so on. So all of these stories connect starting from the start. And what I want to point out that's one of the most important pieces of this entire project is the fact that regardless of socioeconomic standing, regardless of how much money you make, it doesn't matter if you're a celebrity, we are still more likely to be sick, still more likely to die, and that's because of structural racism.
Oh my goodness. I mean, when you put it like that, right? It sort of just lays bare how smart structural racism is, in that it can even transcend your standing on the socioeconomic register. It could transcend your celebrity. It can transcend your access and still affect you in some way.
Yes, and no one deserves to die, but the thought of having, endless amounts of money, you would think you would be protected to have good care. But that's not true. We've even seen doctors, OBGYNs themselves still die in the very hospital that they work at. So what does that tell you? What is the underlying factor here? It's racism, discrimination, not being listened to.
What we also know in America is that, our health outcomes, as you so eloquently point out, are socially determined, right? We call them social determinants of health. And what we know, especially in a city like Detroit, is that your zip code is more important than your education or even eating habits that determines what your life expectancy should be, or maybe even some of the illnesses and ills that you may face. And so you talk about black children are more likely to have asthma. We're looking at a rate of 12.3% of black children suffer from asthma. Talk about spatial and environmental racism and how that also is something that we need to be paying attention to as black folks, because I think sometimes when we talk about especially environmental justice, that kind of rhetoric seems like pie in the sky to so many people. They don't feel like it hits them on their front door. Localize this issue a little bit for our listener.
So one thing that was really interesting that we found was that the same communities that were redlined, segregated more than 60 years ago are the same communities that today are more likely to have these high rates of asthma and all of these other issues that we reported on. Not just that, they're more likely to be close to freeways. They're more likely to be close to polluting factories. All of these things that contribute to something like asthma. And as a child growing up in 48213 on the city's east side, I know that very well. When it was hot summer summer days, it was hard to breathe. That incinerator, we could smell that all the way in my neighborhood. So when you're talking about something that has generationally impacted so many children, this is why. And the why is because our communities are often right in the middle of these toxic zones. And that's by design.
I mean, I wish we had. So I want to let the listeners know that we're going to have Kat on again when we're in the city of Detroit, because, this deserves the entire hour. What we're trying to do is just sort of preview some of the stories that are being told in this Associated Press piece, so that you can go and look at it, apnews.com. Type in Kat Stafford, it'll pop right up. But I want to talk to you a little bit about this stat around racism. Black kids face racism before they even start school. It's driving a major mental health crisis. And so I want to talk about racism, and I want to talk about mental health and its interconnectedness. But, one of the things that came up for me when I began to read this, when was it, last week when it came out? I remember being at Fairlane in Dearborn, right? And Dearborn was changing, but it was really fighting against this change, right? Dearborn still wanted to be white, and Fairlane was a really, really nice mall that had, luxury stores and, all of the above. This was back when Fairlane still had Saks. Remember when Fairlane had Saks?
Oh, yeah.
And so my aunt and I went to Saks. She wanted to go to Saks. I don't remember what she was getting. And I remember her trying to walk me into Saks with her. And the security stopped her and said, the kids can't come in. It was just me. The kids can't come in. The kid have to sit outside and wait for you to, do whatever it is that you want to do. And I remember knowing just intrinsically that was not right. That felt racist, that wasn't how it was supposed to be. And to this day, I don't want to step foot in Dearborn. And we're talking maybe early double digits or even single digits. And so you say black kids face racism before they even start school. Are they aware of it? Or like I was, or is it just systemic? And you don't need a transactional relationship with racism because you were born into it. How does this work?
It's everything. You realize it, you see it, you experience it as a child. It manifests in school, the way that we are disproportionately disciplined, in ways that other races are not. It shows up in the way that we experience adultification, where black children are viewed as adults more than any other race. You can't be a little black boy, you can't be a little black girl in America without being accused of being criminalized. And in this story, we really lay bare what that looks like. What does that look like in even our own communities when we are experiencing, different elements, social elements such as violence or poverty, but even, when we don't experience that in communities, what that looks like, just encountering white folks who want to touch our hair, all of these things that people might brush aside.
That happened to me on this island, by the way.
Oh, yeah. Everybody comes up to me and touches my hair. I hate it. But that starts at an early age, right? So even our children are experiencing the racism, and I believe that they understand it to be racism. And think about the impact that has and how that connects to the fourth story in terms of how toxic stress shows up as a child and then continues to manifest as an adult.
Unpack that for us, right? Because we talked about you're linking this experience, which is trauma, which is traumatic, to mental health outcomes. Unpack that some more for us.
We had one psychologist who we interviewed, and he talked about this notion of boxes of generational trauma and how that has just been passed down from generation to generation and how that impacts us, dating all the way back to slavery and how that looks today, that might be experienced in school. So when you talk about trauma for our children, that's showing up in a lot of ways. It could be traumatic to just not have access to healthy food. It could be traumatic to even be a child and go to the doctor and feel like I'm not being listened to even as a child. So this trauma that we experience, it's all throughout our life, and it connects to what we experience as an adult. And toxic stress is one of the key factors researchers believe that leads to these high blood pressure.
Okay, we know what stress is. What is toxic stress?
Toxic stress is really this confluence of factors that you experience as a black person. So racism, poor environmental factors, living near a factory, all of these things kind of create this experience that is toxic. It's just something that's just overly bad, right? That's the bluntest way that I could put it.
And it's so crazy, we don't even realize it, but I think our body is always in like this mode of, fight or flight. During the day, sometimes I have to remind myself to unclench my jaws and bring your shoulders down and breathe. Like, breathe through it. It's going to be fine. And that brings me to this question around high blood pressure. Everybody talks about it. We got family members who struggle with it. We know that a disproportionate rate of black folks died from COVID because they had the pre-existing condition of high blood pressure. Talk about what you found.
So high blood pressure is caused by a lot of things, but one thing that we talked about was this role of stress, that stress you experienced earlier in life, how that manifests and could create a situation where you have high blood pressure. But again, looking at a community like Detroit, thinking about my neighborhood where my dad still lives, we don't have access to healthy foods. We had to travel a distance to just get that food. And so they want to point to us not making good decisions. Well, there's no clean food near us. And what does that look like if you don't have transportation? So there's a reason why so many of us have high blood pressure. It's not just genetics. There's nothing genetically wrong with black people. It's that we have been forced to live in these conditions that were created for us, not by us. We are forced to deal with these, and now this is the manifestation of what that looks like.
There is nothing genetically wrong with black people. Oh my gosh. Ooh, you know how many people believe that there is?
Oh, I know, and that's why it was important for us to get that in words from medical providers themselves. They said that. There's nothing wrong with black people. This is about social determinants that have been forced upon black people.
My good friend, Dr. Andre Perry out of Brookings Institute, I don't know if you know him, but he always says there's nothing wrong with black people that ending racism won't solve.
That's right. Absolutely right.
There's nothing wrong with black people that ending racism won't solve. And so I want to close out because we're almost at 20 minutes. I want to talk about Alzheimer's because you touched on it in your series of stories, and having experienced it with the elders in my family who have since passed on, and for those who are aging into that age where that becomes a concern, it rips apart families. It destroys a piece of the tapestry, right? That has been woven for years and years and years. That sort of loss of institutional knowledge and memories. Why are we disproportionately getting and experiencing Alzheimer's?
Well, again, all of those things that, we laid out in those earlier stories, the toxic stress, the cardiovascular issues, all of that creates this confluence of conditions where it makes us disproportionately likely to experience it. So again, racism is at the heart of that. And the other important piece of this is that they believe the rates are probably higher. But again, because of racism, we aren't being diagnosed properly because our concerns aren't being heard. You go to the doctor and say, my loved one is experiencing cognitive or memory issues. Will you be heard and listened to? That's a crucial problem. And then if you are diagnosed, what's happening now is black caregivers, that same racism, that same not being listened to that they experienced earlier in life, it again manifests. They have trouble getting medicine. They have trouble just getting equitable care. So even when we are approaching the final years of life, our dignity is still being denied because of this history of racism.
Yeah, this took a year to publish. This was something that was in your mind for a long time. Is something like this easy to publish? Is something like this receive? What kind of reception are you getting, right? From not just the journalism community, not just from your colleagues at AP, but in the public, because this is really eye-opening, fact-based reporting that a lot of us are now going to use and implement in our work of advocacy. And, I'm sure Donna will use a lot of this in her work toward, a more sustainable East Side. How are people receiving this?
that was the whole point of this. And to me, that's how I define impact, is how people receive my work and how they take it and how can it be used to make change. And we've heard from so many people, not just journalists, but people saying, thank you. I feel seen. I feel heard. I experienced this too. And the most beautiful part has been the reaction from the 5 families that we talked to. The sisters in the first story, she said she cried all night when she read the story. And that made me cry, because that's why I wanted to do this. The woman in the last story who takes care of her mother, she texted me at 2 a.m. saying, this I can't believe this happened. I can't believe someone finally cared and saw it through to tell my story to the world. So for me, that's what this is about. And even if it changes at least one heart, one mind, my job was well done.
Kat Stafford, you are a gift to us all. I mean, from your time at the Detroit Free Press, exposing, the demolition debacle and lead poisoning in children, and what you've been able to do at the Associated Press thus far is changing the lives of so many, and it's changing how we talk about and do our work. So I just want to tell you thank you and give you your flowers.
Oh, don't make me cry. Thank you.
It's the truth. From birth to death, Black Americans and a lifetime of disparities. Go to apnews.com to read it. Kat Stafford, thank you for being on Authentically Detroit.
Thank you so much.
This is Authentically Detroit, broadcasting live from the Grand Hotel in beautiful Mackinac Island. We're here at the Detroit Regional Chamber's Mackinac Policy Conference, and I am sitting with Nicole Stallworth, the newly named President CEO of the Children's Center. Nicole, welcome to Authentically Detroit.
Orlando, thank you so much for having me.
It is an honor to finally meet you, because everybody knows the name, everybody knows the work, and so I am delighted that our listeners get to hear your voice. I've been getting everybody's reaction to the Mackinac Policy Conference in general. The theme this year is the power of and, right? We're here on this beautiful isle. It's beautiful. It don't smell so good, but it's beautiful. It's nice outside. Tell me how you're reacting to the happenings here, the conference and its theme, and just being here. How are you feeling about it?
This is such an important conference to be a part of. I've been coming to the Mackinac Policy Conference for many, many years. And it's just a time for leaders to get together to discuss all of the policies that are meaningful for our state and our cities and local communities to be able to move forward. So in that regard, I'm very happy to be here, and I'm really happy about the content. The power of and is an interesting one, right? Because, we have done a lot in the past few months, in fact, and over the course of the past numbers of years, to be able to ensure a number of successes. And what is next? And who's missing in the conversation? And who else do we need to bring in and keep them under the tent? Which is why I'm really excited about my new role as president and CEO of Children's Center, to be able to ensure now that the voices of children are actually included in these conversations, that the service providers who provide their clinical therapy and the social workers that provide some of the case management and other services are also heard in their quest to be able to really provide this vital and needed behavioral health care that so many of our children are crying out for in today's age.
I want to tell you a quick story. So my senior year of high school, we moved into a brand new building at 123 Selden Street, which is the Detroit School of Arts, and it is directly across the street from the Children's Center. So I have this affinity for the Children's Center because I had to, ride by it every day, right? It's a beautiful, beautiful edifice in downtown Detroit. I want you to talk a little bit about how you see just sort of, the current conditions, especially around mental health, the current mental health conditions of our young people in the state, but specifically the city of Detroit as we emerge out of COVID, as we are dealing with learning loss, as young people just sort of begin to grapple with the fact that they may experience, some sort of large traumatic event like a mass shooting or something, at their school. So how are you approaching, current conditions among young folk in the city of Detroit?
This is such an important question, and shout out to DSA, all of those young people who came through Detroit School of Arts. And right next door to Children's Center, we have hosted, when I was there from 2011 to 2014, we hosted a number of events and outreach activities at DSA. The thing that I want to lift up around why children's mental health care is so important is a number of things. We are living in a time where so many young people are self-reporting that they are experiencing depression or they are experiencing angst or anxiety. I think it is really important for us to recognize that we are hearing that and that we are able to respond to what it is that they're saying that they need. And they need support. They need access to the behavioral health care and the clinical therapy that in order for them to live a full quality of life. And that's really our goal and desire for all children and all young people, to provide them with the support so that they can live a full and happy quality of life, which is also so important. You mentioned school shootings, and you mentioned some of the other things that are taking place in our environment now that we're seeing just mass shootings in general becoming more and more prevalent. And young people have so much access to that through social media, but might not always have the tools to be able to understand how to really process that effectively. And so this is an issue that I believe it needs to take priority among policymakers and legislators and other decision makers as well, and as just community members in general. Because there is no other time where the correlation can be more evident in the fact that access to mental health care services, behavioral health care services, emotional health care services, and its connection to healthy communities and communities that are well. This is a matter of importance, and it is a public health imperative, which is why I'm really excited again to be assuming this leadership role.
Yeah, it is exciting. I want to ask you, I guess, just a little bit about prevention around making sure that we as a community are doing everything that we possibly can to keep young folks out of the carceral system. So right now we're dealing with a public health crisis in the Wayne County Juvenile Justice Center. Right? And the state and the county are trying to figure out how to rectify that. How does Children's Center interact with the county in the state in terms of keeping young folks out of the criminal justice system?
Well, I'll start by saying that the county health system and Wayne County Integrated Health is an important partner for Children's Center. Children's Center has long served children and their families who may have found themselves involved in the criminal justice system, and also the school systems where if children are coming into school presenting with any sort of a symptom that may lead to a behavioral health diagnosis, Children's Center has been on the front lines and partnering with school districts and school systems and other community organizations. As we begin to move forward, we don't anticipate changing that. We want to strengthen our relationships with all of the entities that support children in order to prevent them from getting involved in the criminal justice system, in order to prevent them from being suspended from school. And we know that school suspensions are a direct correlation to the school to prison pipeline. So these are all the ways in which we try to support children as they are processing their own bodies and their minds. We also believe that behavioral health care is just an extension of health care. Behavioral health care is a part of your total well-being, and it should be a part of your total health care plan, no matter who you are. As we begin to sort of shift the paradigm and work with our community partners on that, ensuring that we see that behavioral health care is treated as one and the same with health care, these are some of the sort of initiatives that we will continue to work on as we begin to broaden that scope.
And that goes a long way towards really combating what we call stigma, right? Especially amongst Black folks, because we are hyper aware of stigma, and we don't want our children to be stigmatized. All of those things. And so when you talk about behavioral health being integrated in overall healthcare, I think that goes toward tearing down that wall, because it's healthcare, right? It's essentially healthcare.
It is essentially healthcare. And, to talk about the stigma, it's interesting how over the course of the years, different generations, in particular, I'm a Black woman, so in the Black community, I feel like I can speak with authority about this matter around, the stigma of behavioral health. And I think that we're seeing now where, I cited the reference that is well documented by the CDC that more and more young people are experiencing and admitting to feelings of anxiety and depression, where they're saying, hey, I am having these feelings. It is all of our responsibility in this moment and at that time to ensure that they are wrapped around with all of the services that they need. And as adults, we also have to take care of our own mental health. We also have to make sure that we are doing all the things to take care of ourselves so that we can take care of our young people. These are the things that I'm hopeful that as we start having these conversations, we can have a more well-rounded conversation about all of the total well-being needs of our communities. I believe that starts with children. And so I'm really looking forward to serving in this capacity.
Yeah, a little bit earlier you talked about being on the front lines, and there's a saying that we say in community development that people on the front lines oftentimes have the answers and the ideas toward remedying whatever inhibitors there are to thriving on the front lines. And so I want you to talk a little bit about your history, because you get stuff done, right? And you've been getting stuff done for a long time. And I know that Children's Center will also become a mecca for policy advocacy and change as you take the helm in the executive seat. But in your tenure at Planned Parenthood, you made sure that women had a choice in Michigan. Talk about that.
Yeah, it's really such an honor to be able to serve as Executive Director for Planned Parenthood Advocates and Vice President for Public Advocacy at Planned Parenthood of Michigan. And I was, during my time at Planned Parenthood, afforded the opportunity to serve as one of the founding co-chairs for the Reproductive Freedom for All initiative, where, Michiganders voted overwhelmingly to secure that Michiganders could have reproductive freedom and they could protect their own choices as it relates to how they want to go about their pregnancy. And that is all stages throughout their pregnancy, in making sure that they could be the decision maker around their birthing plan, whether or not to have a doula present in the room, and not be punished for their birthing outcomes, whether that be stillbirth or abortion. These are things that I think are an extension of my inherent advocacy efforts. I've been involved in not only that at Planned Parenthood, the voters decided that. That was a citizens-led initiative that I was fortunate to facilitate and be a vocal spokesperson for. And, in my role at Planned Parenthood, we were able to facilitate that process on behalf of Michiganders. But make no mistake about it, that issue was about quality of life for people, what people feel like they needed in order to have a quality of life. And I don't think that this issue is much different than that, because children and their families need to be able to have access to behavioral health care in order to have a full quality of life without them being stigmatized or without them being denied that access based on where they live in the state, where they live in the city of Detroit, without them being denied that access based on what school that they attend. These are all the things that work together so that people can have a foundation upon which to decide how they want to build their own life's trajectory. I was once a child, so my inner child is very excited about this, because I remember the times of not being in control of my own environment and my own living circumstances. And a lot of times we take for granted that children, all children have the same makeup in their own household. Challenges are different from family to family, and it's really important to honor the fact that everyone is different. Honor that difference. Honor the fact that just because we're different, we don't deserve to be denied access to like some of the most critical and basic needs around things that we can do to support ourselves and things that can be provided in order to support families in their ability to thrive. And that's really how everything ties together for me. And that's what I hope to bring, and that's what I intend to bring to this work.
Nicole Stallworth, thank you for being a vessel for and a force of good. I mean, just amazing. You take the helm in July at the Children's Center. So, check her. Go check out Nicole Stallworth over on Alexandra and at the Children's Center, everybody. Listen, thank you so much for being here and joining us here on Authentically Detroit. We hope to see you next time.
Thank you so much, Orlando.
A pleasure. It is Authentically Detroit, and we are broadcasting live from the beautiful Grand Hotel on Mackinac Island. We are here at the Detroit Regional Chamber's Mackinac Policy Conference, and we have two special guests with us. We have Christy Ayers and Deborah Bayer from the Workforce Intelligence Network. Christy and Deborah, welcome to Authentically Detroit.
Thank you for having us.
We are constantly having a conversation about workforce, access to career pathways, diversity of economy and training and all of that. And so it was really, really encouraging when Alicia approached us and said, hey, we do a lot of stuff around workforce and we work with the partners that we know and love, like Detroit Employment Solutions and Michigan Workforce, Michigan Works, and all of that. And so tell us a little bit about WIN for short. And how long you guys been around and some positive outcomes that you guys can point to.
So let's talk about the great things. Workforce Intelligence Network is a consortium of the 10 community colleges and 7 Michigan Works offices that make up Southeast Michigan. We cover the 19 counties. WIN was formed in 2011 as part of the New Economy Initiative.
Okay.
WIN has now,
okay.
Yeah, we are
Gotcha.
We're an arm of the Southeast Michigan Community Alliance.
Yeah.
We're a nonprofit. Our board is made up of the presidents and representatives of each of the colleges and the Michigan Works offices. So the reach is wide. We have probably over 70% of the workforce of Michigan in Southeast. So coming together as a consortium made it easier to go after large grants for workforce development versus competing against each other. It was a way to go after things that would really make an impact. Mm-hmm. So one of the things we're working on is really creating like an apprenticeship ecosystem, a workforce ecosystem in Southeast Detroit. Mm-hmm. So by working together collaboratively, again, we're not competing for the dollars. WIN has brought in more than $188 million in the last 11 years.
So when you say apprenticeship ecosystems, what kind of apprenticeships are people being placed in? Is this for one kind of career or economy or multiple?
Several. So WIN right now has several initiatives going on, one of them being the governor's initiative for the electrification of vehicles and mobility. Yeah. Our EV Jobs Academy grant is $5 million, and we are reaching the entire state with that grant. One of the things that we've done is we are conveners. So we bring employers together to discuss what are those jobs that you need for the future to make this transition to an EV jobs.
Because we're hearing a lot. We're hearing that language a lot.
Huge.
It's something that the governor is talking about, EV.
Yeah.
And
absolutely.
It's a new kind of economy, and folks who live on the margins are always a little apprehensive about new economies because the skills gap there, right?
I think there's a skills gap, but also there's entry-level gaps.
Yeah.
There are
absolutely.
There's gaps in terms of basic skills. Reading and math is sometimes stand as a significant barrier in healthcare. Sometimes even basic science skills seem to be barriers. How do you help people who are the most marginalized people in our economy overcome those barriers?
So most of our grants are used to target underrepresented veteran populations, minority women. We're also working with Michigan Rehabilitation Services, people with disabilities that need assistance with minor things to be able to get into the workforce. But we were working with the K-12s through the community colleges and things like that to identify, again, with our employers telling us what they're going to need. So now let's talk about the electrical and electronics, the sciences that are needed, computer skills, the basic technology. And the EV Jobs Academy, this transition to EV, to vehicles, to mobility, to automation, this is a generational transformation. It's not happening overnight. So as you said, we have to start focusing on our youth. What do you need to do to be prepared for these jobs of the future? So let's get them into, we hear about STEM and STEAM and getting them into those programs. So one of the things that through our grants, many of our grants have funding for short-term training, long-term training. So we have tuition reimbursement dollars that can go to companies that are employing apprentices. So long-term investment in their employees. But we also have short-term training grants. Our Building an Industry Infinity Supply Chain grant that Christy heads it's short-term training. If it can result in a job credential, an occupational credential, whether it's in advanced manufacturing, in IT, cybersecurity, things like that, or transportation, our Michigan Works partners can pay for that. And we can take somebody from having no career at all to a short-term training and getting them on a career path. Yeah. Or we can help employers that have people that they're there, but they could get more use out of them if they could get some additional training. So we can fund the employer training to get them skilled and moving up a career pathway. So it opens up the entry-level jobs.
I really want to celebrate DESC, Detroit Employment Solutions Corporation, and the work that they do to reach the individuals that have barriers to employment. I think that they do an excellent job meeting people where they are, identifying all of the things that they can do to really catapult that person into a career. And some of that is those basic skills that they need to even start some of these trainings.
Right.
And they identify these short-term trainings that they can get into a job really quickly, so they don't have to put their life on hold for a very long time, or they can identify programs where it works for their life. So if they're a single mother, we have a lot of success stories coming out of DESC, single parents that have been identified through their outreach.
And then go through these academies, these training programs.
I oversee the Industry Infinity short-term training. So those are short-term training we have seen a lot of CDL programs that get people into those really high-paying jobs just after a short-term certification program. So it also aligns with the governor's 60 by 32.
The other thing that sort of comes up for me is, especially for, individuals who are really impacted by inequities and adverse systems, is that, sometimes training can be a barrier in terms of costs. It can also be a barrier in terms of, is this a paid training? Is it not? Because, my need for money is urgent, right? So how are you guys looking at that and addressing it?
So one of the great things about having multiple grants and using the Michigan Works system to do this is that we can braid the funding. So when I say braid the funding, we can have one grant, we call them last dollar grants, that can actually pay for anything that the other grant won't. So if one grant will pay for someone's tuition to get through the training program, maybe another one can give them money for transportation, for daycare, covering things like that. There's also, like I said, money for the employer to cover their costs so that they can let the person go for the day, so that we're not losing funds to go to training. We owe dollars, whatever those wraparound services that are needed, there's something there that could fund those by, again, creating this ecosystem where we can reach the outreach into where people are at instead of waiting for them to come to us. Some of these grants will buy computers for for them to have, not only to go through the training, but to keep for after the training, so that they can remain successful as they're moving through these careers.
So can you talk about who's getting these trainings? What part of the area they're coming from. This is for Southeast Michigan, right? And so what part of Southeast Michigan are you getting the most participation from, and where are you working to increase participation?
So DESC, how many, do you have a number on how many you have so far?
They have met their goal for the 4-year period so far.
Oh, wow.
But there is still $2.9 million left for training dollars. They've been very efficient in the use of that, specifically just speaking to Detroit, but we have had great success throughout the entire region. We've already trained 800 people in just under a year and a half through these short-term training programs. So we're really changing a lot of lives in Southeast Michigan. And we also do have programs in the Lansing area, as well as we expanded to transportation, which was a new initiative for WIN, but we've seen great success that's been recognized nationally with this program.
So you mentioned single mothers, but what other demographic populations are you working with? I have specific questions about immigrant and also returning citizens, people whose citizenship status is not quite qualifying them for many programs.
We have wonderful numbers. We do track that. That is part of the Department of Labor request.
I can tell you track it because you smiled.
I was
big.
like,
It's
yes.
yes, this is the question I wanted.
We love this stuff.
Because we are so excited about the opportunities that these grants have for the people and the communities that we serve. And we see the Michigan Works agencies work so hard to develop relationships that put people into major success after they're a returning citizen. We have one example of a success story. One of our Michigan Works agencies had followed up with one of their participants, and they said, I'm really having a hard time finding a job because of my record. I'm a high risk for insurance, so I'm kind of unemployable. And they're like, you're not unemployable. We just need to get the right employer. And so they use their relationships through their business services department to identify an employer that was more than happy to take this individual. So that's just one out of the 800 participants that we've had go through this program. So
SEMCA, Southeast Michigan Community Alliance, has folks that speak 19 or some different languages on staff, because we want to make sure, again, to reach those communities, the immigrant populations, help them get prepared to be employable. It's important. We have to have everybody working to really increase the economy and
to keep people in the state, because we've been talking a lot about population. I want to talk about the Health Careers Alliance for Southeastern Michigan. You guys haven't mentioned it yet. An employer-led collaborative comprised of statewide and multi-state healthcare systems designed to convene healthcare employers to identify strategies addressing common talent needs, focusing on several high-demand occupations, including certified nursing assistant, medical assistant, sterile processing technicians, and nursing. I'm asking this question because last week the Associated Press released a series from birth to death, right? And talked about the adversities that Black folks face because of structural racism, particularly in the healthcare field. And what we know, or what we can probably assume, is that when folks who have been impacted inequitably by healthcare systems and they get jobs in the healthcare systems, they will probably begin to chip away at that. And so talk a little bit about that program and how that program works.
So the Health Careers Alliance is an employer collaborative that we are leading through one of our grants, and it has pulled together the healthcare systems providers such as Cornwall Health, Henry Ford, McLaren, all of the systems that are looking for how can we fill these much needed jobs, not only in the hospitals, but in the clinics, in the we're an aging home healthcare. We're an aging population, and by doing this, by bringing them all together to work on solutions, some of the things that have come out of that, we know, say one hospital needs 2 surgical technicians and another hospital needs 2, but they're in a totally different county. For the community college to put on a program for 2 students, it's very, very expensive. But if we can find ways, we are collaborating on a statewide level with the community colleges where through a platform they can deliver the coursework online and then work with the local hospitals to provide the clinicals. So we can take 2 kids from the west side of Detroit and 2 kids from Livonia and 2 kids from over in Ann Arbor with different colleges and have them in a program where all together, and so that we are serving the need of the employers when they need them, not when we get enough students to be able to do a class. And so that's one of the ways that we're doing it. We're also, our employer partners are looking at how to use apprenticeship to start someone on that pathway, getting them in as a CNA, and then through apprenticeship with the hospital system, working them up from CNA to a medical assistant to an LPN, and continue them on that path by, investing in that person and creating, those steps to the higher employment.
Do CNAs earn a living wage?
They're making more now than they have. I wouldn't have called it a living wage a few years ago, but the need is there's such a demand. So I'm sure it's where you're working, they're making more. But we see that as an entry step.
Yeah.
CNAs are much needed, but it's definitely, it's a step to get into the healthcare.
We have so many positions that are typically women's jobs, like CNAs, childcare workers, teachers to some extent, who are so vitally needed in our community and yet underpaid. And how do we right-size the pay so that we can attract people to these fields? We tell, children or teenagers that they don't need to go to college, but if you're a girl and you are not going to engage in traditionally male work, earning a living wage is a little bit more difficult than if you're a boy.
Absolutely.
Yeah.
The state of Michigan lost more than 200,000 women from the workforce during COVID that haven't gone back into the workforce because of childcare issues. So one of the things that we do is we've brought in state programs and employers to talk about how they can help with the childcare needs of women wanting to go back to work or needing to go back to work, because until those kids are in school full time, you can't just try to work and take them with you. So those are some of the things that we're trying to address with these collaborative programs.
We've got to be a more family-friendly state, and we also have to look at workplace equity and paying women what we are worth.
Thank you.
If there is such a shortage of jobs, you cannot simply train people and attract people into trainings for jobs that don't pay them, what they need to be paid. So I'm really interested in seeing how we can sort of look at this period where we're trying to attract people to the workforce to change some of those metrics.
I think the apprenticeship piece really just sets that stage for that long-term success. You get in that entry-level position, and then you know where you're going. You know when your next raise is going to be if you meet your marks. You know what your marks are. Yeah. It's a really beautiful program.
Yeah, one of our grants right now is Apprenticeship Building America, and we are a hub in Southeast Michigan to work with employers to create that pre-apprenticeship. We're working with the K-12s, career tech ed programs, things like that, to develop what is that pre-apprenticeship needs. We talked about the skills needed for, the sciences, the computer, the technology, and things like that, to get them on these tracks. Like you said, who wants to come to a state if you're going to come for a $10 an hour job or $12? That's not a move. So we have to focus on really creating the jobs and the ability to get into those jobs through the appropriate training to make a living wage, a good wage for your family.
So Focus Hope used to have a fast track program that fast tracks people's reading and math skills, because that becomes the barrier for so many apprenticeships and other programs. Even some of the nursing programs and community colleges do not train American applicants, certainly Black American applicants, and those coming from low-income households do not qualify for these programs. And so even though they're at the community college level, they're inaccessible.
Well, Focus Hope is one of our partners, so we do work with them. Our community college partners are working with them on a lot of things to do that, prepping them to be in these programs to be successful. So it's a very important part. As a matter of fact, I think we just wrote a support letter for Focus Hope on another grant for them. So we partner.
Yeah, we had Portia on earlier, and I forgot to ask about Fast Track because I remember how vitally important that was. And I really do love the idea of the apprenticeship, because if people can understand what's at the end of the rainbow, it's so much easier for them to make the sacrifices now.
The other thing is these are for the hands-on students too, because not everybody is ready or wants to do a 4-year degree. You know, I was a community college student. I went right into a career hands-on, you know, and it's then went back for a degree later when I understood what I was doing and what I needed.
I mean, I have family members who've done just that and doing very well. But I think it's the understanding what this looks like. I mean, community colleges have a very low success rate when it comes to retention and graduation from any programs because students enter in there, and I don't think there's always clarity on what it's going to look like at the end.
I just want to celebrate our case managers. Again, let's talk DESC because those relationships are what makes all of the participants successful. They identify if they need all of the services and they connect them with a Focus Hope or things like that. We're not automatically shoving them into community colleges. We are making sure that they are ready for that program and they have everything that they need to be successful because they're an investment.
That's wonderful to hear.
All right.
The other thing that we're paying for with these short-term training grants is that we know that, we have to give people an opportunity to get on and off the bus. Everything is not a 2 or a 4-year degree. So like I said, life gets in the way. So if we can get them into a short-term training and get them into a career, they can start making money. They can start, getting the loyalty of the company. The company's now investing in them. They can come back and get that next level of training so that they can get the promotion and keep moving up. It's not an all or none. It's let's help you with these increments to get you trained. I mean, we've already in one grant, we've had a couple of folks that, coming in with a startup training. They got into a company and then the company's sending them back for either CDL or something else so that they're like, this is a good worker.
Continuing education.
Continuing. And it's really big
Stackable
with
credentials.
Stackable credentials.
Wow.
That's
Like
been a
that
phrase
term.
for a long time. Yeah. Stackable credentials. Get them in the door and, get them acclimated. They like the environment. We want to keep training them and help promote them up.
Now, I love the idea of the EV Jobs Academy. Right now, there's a focus on EV jobs, but there's so many jobs where we're not really preparing people because a lot of times we're not training people for jobs that are not here. Well, we need to train people for jobs for the future, even if they're not here yet, don't we? And how are you working to make sure that we're ready when we want to? We have electric vehicles. Who's going to build the solar panels? Who's going to install them? The electric, appliances,
the charging stations, the batteries,
so much stuff that we don't have
So
training
a wonderful thing that's happening with the EV Jobs Academy. We've brought the employers together and said, what are those jobs we're going to need to transition to electric vehicles? So we've identified that battery technicians, charging stations, automotive repair. Like, why would you buy an EV? Electric vehicle if nobody can fix it for you if anything's wrong. So it's really important to look at all of those aspects. So one of the things, one of our partners, Henry Ford Community College, through our Industry Infinity grant, is doing battery technician curriculum. Right. So this fall, Henry Ford will start battery technician training, and we're doing it on the platform I was talking about, where students from other colleges and employers can take the battery technician program through the what we call the EPIC platform, Educational Partners in Collaboration, and it's to start getting that's going to be an important piece.
That's extremely important.
Huge.
But when you look at so many other aspects of green jobs, and I'll give an example: green infrastructure. It's really expensive to get green infrastructure in Detroit, in part because you have so very few people who know how to do it well. Because you have so very few people who know how to do it well, you don't have a lot of green infrastructure companies. Because you don't have a lot of green infrastructure companies, it's hard to get public funding to invest in green infrastructure jobs. How do you begin, or is your organization equipped to help seed some of the training necessary to attract industries and to bring new types of work where there's not already a market that's been established in our community?
So SEMCA, our parent partner, the Southeast Michigan Community Alliance, has just received a grant from the state of Michigan as part of this governor's initiative to focus on the charging station infrastructure. Now, need to be an electrician to be able to be a technician. So it's really important to understand
Those
the ones that are
delineations and
building that.
nuances.
A technician can be building that infrastructure and not be a 4-year, 5-year, 6-year apprentice electrical electrician to be able to do that. So there's technician training that can be done to build that. And infrastructure is huge, especially in cities like Detroit, Flint, Pontiac, Ann Arbor, where they're older cities. The infrastructure is old. The homes are older. So the electrical has got to be upgraded to be able to really handle all of that. So
I think that we can speak to Wayne County Community College District. They have a wonderful apprenticeship program that is also attached to it with the Industry Infinity Grant, but they're developing programs in partnership with Detroit Department of Transportation and really identifying what they need, and they are literally meeting all the time.
Well, that's amazing. We want to thank you, Christy and Deb, for coming on with us from Workforce Intelligence Network. I got a feeling that we're going to be keeping in touch. I appreciate you all for coming on Authentically Detroit.
Yes.
We appreciate being with you today.
Just real quickly, if somebody wanted to get in touch with you, do they want to enroll those programs? Do they get in touch with you, or how do they access these programs?
They can, winintelligence.org is our main
Say it
site.
again.
winintelligence.org. They can also send questions to info@winintelligence.org. But the winintelligence.org website has all of our initiatives, so you can click on the initiatives and get more information about each one. We also, like I said, info@winintelligence.org. If anyone has a question, they'll be directed to the person that's responsible for each of the grants. And all of our Michigan Works agencies in Southeast Michigan, if they call and say, I need to talk to somebody, I'm a job seeker and I'm really interested in getting into a career, whether it's in EV, healthcare, IT,
and upskilling, not just getting into a career.
The other thing is employers. Employers, if you need to upskill your workforce to continue to be competitive and you want to invest in them, let's invest in your folks that are already committed to you. That leaves the door open for those entry-level folks, too, to get in with you.
All right, Deb and Christy, thank you so much.
Thank you.
Thank you, guys.
This is Authentically Detroit, broadcasting live from the beautiful Grand Hotel on Mackinac Island. We're live at the Detroit Regional Chamber's Mackinac Policy Conference, and we have a very first-time special guest with us in the person of the Detroit Free Press's editorial page director, our good friend, Nancy Kaffer.
Hey! Can you believe it's the first time, Orlando?
I can't believe it. I told her before we started recording that this is her fault that she hasn't been on yet. Hi, Nancy.
You know what? I feel like I talk to Nancy all the time. I read a column. I read something she says. Sometimes I post, and sometimes just have these conversations with you that you don't know anything about.
Well, I'm very excited to be here, and you may not know this, but sometimes when I write a column, I think, I wonder if Donna's going to like it. And if Donna liked it, then I'm like, yes, I did it right. And if Donna doesn't like it, I'm like, it's probably the algorithm. She just didn't see it.
Oh my gosh, that's hilarious. Well, welcome. We are very excited to have you. A piece of history, really, that you are walking in, a walking piece of history. The first woman to be editorial page director for the Free Press. How does it feel?
It feels weird.
Yeah,
I mean,
and
it's
overdue.
surreal.
I can't believe this. We're still having those kinds of
It's
firsts.
Absolutely. And you're just not the first woman editorial page director, but you also have a woman publisher.
Or
now.
editor, excuse me.
Yeah, we have
Yes.
had, the Free Press has had a female editor and a black editor. This is our first black female editor. So,
okay.
Nicole Avery Nichols, who started on Monday.
Yeah.
Or Tuesday, rather. Monday's a holiday.
I got to see her at the SPJ Awards a couple weeks ago. Yeah, she
It was
made an
great to see her there.
appearance.
Well,
Yes.
that's absolutely wonderful that, how old is the Free Press? 152?
192 years.
And
yeah.
192-year history, we finally have women in charge.
I love to see
a
it.
black woman in charge, and then a black and a woman in charge of the editorial page.
Yeah, and I will say, like, the editorial page editors who preceded me were all incredibly brilliant, talented, insightful men. But, it is good. I mean, I'm glad I have the job. So
I'm glad you have the job, too, because, one of the things that I've always appreciated about you and your reporting is that you were always willing to go into communities and listen, right? I can't tell you how many community meetings I threw for ECN, and Nancy was just in the audience, just taking it all in and listening. So thank you, really, for always, keeping a listening ear on what's happening in the streets.
I really appreciate that, and I really appreciate, that's our job as journalists, is we have to listen. And even in opinion writing, a lot of times I'm telling people what I think should happen, but it's not just saying what I think. Ron Zwankowski, who was editorial page editor of the Free Press for a long time, described opinion writing as what we think about what we have worked to know. And no one, like my mom and my husband and my best friend, should care about what I think, but anyone else, I have to convince them why they should care about what I think. I have to do my due diligence, my reporting. I have to listen, because the other thing about opinion writing is it's advocating for a better world, more just and equitable outcomes, better governance, cleaner, safer environment, all kinds of things. But to know what those things are, I have to hear what people
are saying.
Yeah.
Speaking of that and caring about, what you think, I want to ask you what you think about this conference and how it feels in your body. The theme is the power of and.
And I think that's ridiculous. No, I'm just joking.
So how is that sitting with you, and what's sort of bubbling up to the top in terms of takeaways, maybe even challenges or anything you want to take back to the page or,
So I'm not big on like jargony slogans. So I mean, a lot of the speakers here that tagline, "The power of and," has seemed to resonate with them, because a lot of them have kind of crafted their speeches around it. So clearly it's working for them, and that's great if that helps them frame how we need to approach things in the state. Is interesting this year. I wrote a column that came out on Wednesday. There's a lot of stuff on the agenda this year that business did not even concern itself with when I started coming to cover this conference in 2009. Like, there's stuff about affordable housing and child care and equity and criminal justice. And these things that I think business would have very strongly said wasn't its business, now is having some panels, like a commitment to actually doing something. I'm not that naive. But it's interesting that they've shifted their focus to include
Why
these
do you
things.
think that is?
Well, I think partially, so the chamber did some polling before the conference, and one of the polls said that like 65% of the voters they polled believe that businesses have a role in social issues. Younger people, I'm not a younger person anymore, but younger people.
You're younger than me.
But older than Orlando. Orlando, your generation and younger is really, this is a generation where you're more inclusive-minded, you're broader-minded, equity-minded. It's a generational shift that I think is really positive. It's also the largest generation coming up. And I think that employers who want to attract young talent have realized that they need to at least try to engage with these issues. Now, we saw, of course, in 2020, every company thought they needed to say something about George Floyd and police reform. And, that's not really DEI, and they were going to do things differently. And I think it would be really fascinating to have data on what
it would be fascinating
did.
because I'm here and I'm thinking about folks who are here who may be younger than me, and there's not a lot of folks who are here that are younger than me. And so when we talk about that kind of inclusiveness and the retention of population and talent, right? Even, if this conference is representative of the people that we want to retain, then we're not doing a great job.
I'm not sure that that's what the conference is. I think the conference is a representation of people who want to empower.
But we're talking about it. We're having these conversations around, you know what I'm saying? Like, we're having these conversations around talent retention and why folks my age and younger are leaving and not staying, and how do we engage the millennial? How do we engage the Gen Zer, right?
Right. I'm just saying, I think that there's a gap between who comes here. Because, inclusion would mean that we actually don't have it possibly here. I mean,
Right.
I get kind of excited coming here, but inclusion, if you really want to figure out how to reach those people, you've got to have it in a place where you come in contact with them. It feels like this is a place where business and political titans and people who are just trying to hang on like me come together to have some conversations.
You're
and
doing
network.
more than hanging on, Donna.
Well, I've been talking all afternoon, but this is a networking space, right?
Right.
I think the challenge with me with the power of and is not the whole concept of it, because sometimes you do have to balance, and I believe in balance. I think sometimes you think it's got to be either or, and sometimes and makes sense. But sometimes it's either or. Either we are going to have, women's right to choose, or we're not.
Yes, there's no and there. Sometimes you've got to stand.
You have to make a stand. And sometimes that means there's got to be a change of policy, and there's got to be sacrifice for the current way of living if we're going to make the kind of changes we need to make. When I look at things like global climate change, we don't need to say that we can have everything that we have and keep moving forward. We need to make some choices and sacrifices. What kinds of choices and sacrifices have you been hearing some of the speakers talk about today that reflects something beyond this whole power of and?
Well, now, of course, I don't know that I have. I think that there's been a lot of positive, forward-looking stuff being talked about. I think that's kind of what happens here. Like, they're ringing the alarm on population.
Yeah.
And ultimately, all the stuff you said about needing to be more accessible if you're trying to do a variety of things is true. This is, at the end of the day, the Detroit Regional Chamber's event, and it's geared toward, like you said, toward business, it's geared toward policymakers, and it's a networking, it's one thing. And I don't know that this is the venue where, I haven't heard that, what you're talking about, sacrifices and hard choices. This is all about, the mood here is like, yes, we're going to grow population, we're going to grow business, we're going to do things. But here's a thing that I was thinking about, though, with some of the more broader social subjects on this year's agenda. So, I was at Motor City Pride last year, and it was during the middle of the Prop 3 ballot initiative fight. And it struck me as interesting, I wrote a column about this, that we've reached a spot in our culture where every corporation wants their logo plastered all over Pride. Now, does that mean that back at their workplace that they're LGBTQ inclusive? Who knows? But they all want their logos all over Pride because LGBTQ activists work really, really hard for decades to change this math so that there's a benefit for companies to endorse LGBTQ rights. We've seen the business community in Michigan get behind Elliott Larson's Civil Rights Act expansion. It finally happened this year. But that's not a thing that just happened. That was hard work by activists to change the conversation so that businesses and politicians saw a benefit in embracing this portion of civil rights that was once off limits. So when I see them talking about that, I think about here at this conference, we talked about pre-K investment a lot for years and years and years. And now pre-K investment is a part of the budget. We don't have to make the case for it anymore. They're putting money into it. They're now proposing universal pre-K. It's taken root as a concept. So, I get a little eye-rolly about there's going to be this panel where they're going to talk about criminal justice reform because they care about that this year. But is one panel 1 year signal some kind of big change? No. If the conversation starts happening, so the reason they're talking about it here is because activists in that space have worked on it long enough and hard enough that they've changed the math on this so that businesses that once would have steered totally clear of this, it's been made obvious to them now at this point that they've got to get into this because it's something that their future employees, their customers care about. And
all of that is super important, and I get that, and I support it.
Okay, good.
But my question is this. Will they then contribute to PACs that support politicians that want to destroy all of these things? Or will they come here and give lip service to and use the power of their money to try to exclude these things? It's one thing to say, LGBTQ rights. And it's another thing to look at. Last count, there were over 250 bills across the nation written against anti-LGBTQ, anti-trans legislation. Are they willing to say, I'm not going to give you my financial support as long as you are endorsing this level of hate?
That's an excellent question, and that's one of the things that it's my job and to stay on them and to investigate what they do. Because having a couple panels and conversations is not a commitment to change, but also the activists that work to put criminal justice and childcare over decades on the agenda here. Not literally on the agenda here, but worked to change our conversations. They're not like stopping either. So those folks are going to keep doing the amazing work they're doing. And but I agree with you 100%.
Criminal justice has been on the table for a long time, and yet there's this article that just came out a couple months ago. You know this one, where the man sued the Department of Corrections, denied having sent out a memo to say that people could not stand
medicine thing
to get their medicine if the weather was below 32 degrees. Now you can stand there if it's 33 degrees outside. And all of it seems so inhumane, and the fact that you had to have a court order, and then is this a memo? Well, it's a memo, but it's not really a memo, and it's kind of crazy. I mean, it's like this is 2023, and we are literally dehumanizing people at that level despite this long fight for criminal justice reform. It feels like we're not making any progress.
Well, I have to say I have to give a compliment to my coworker Paul Egan, who reports aggressively and extensively on the Michigan Department of Corrections. That was his story about the medicine lines.
Right, I thought it was yours.
Yeah, and Paul Egan is an amazing reporter. He, no, you're right. People aren't just going to do the right thing. That's why we have to have activists and journalists and community groups and all these folks who constantly provide that other tension on the other end of the line. And stories like, Paul writes this story about the medicine lines, and now we all know about it and we can act on it. But of course, it's crazy that it's 2023 and we just got these very basic gun reform laws introduced, that it's 3 years since the murder of George Floyd, and they're finally probably about to reintroduce the criminal justice reform bills that they started, trying to move in 2020. And, the folks working on it, Stephanie Chang, our state senator from Detroit, she's really diligent and worked really hard on these. There's just they've got to get, hopefully they'll get some motion in this session on that. There's, it took, I wanted them, I'm impatient. I wanted them to repeal the 1931 abortion ban on the first day of the session. I thought they could be done by 5 on that one. But it's really frustrating. This stuff doesn't happen when we want.
To know me, I love Stephanie Chang. She's been marvelous as a state senator. She's done so much. She writes so much legislation and is involved in so many issues. And we have many good legislators who are doing the right thing, and certainly other elected officials. I'm really thinking, though, as we're here and we're listening to this, where is the accountability that we bring back to this table, right? Where when people are saying these things, civility, power van, whatever the theme is of the year, and it's always really nice, everybody clap for Liz Cheney today, yay, not me, but she got a lot of applause lines.
I don't clap on the clock.
I don't, she got a lot of applause lines, and that's cool, and I'm not hearing any boo hisses and stuff, but I know that there are people sitting in that room who contributed to people who helped her lose her job because she did the impeachment thing. That's like the one good thing. Maybe she did one or two other good things, but she has not had a long track record of doing the right thing according to my, value system. But
I'm with you.
Everybody's clapping for her, and nobody's booing her. But we know that the Michigan Republican Party has been her biggest opponent. And or contributing to all of this. And so I'm wondering if we're having here on this island is an authentic conversation. Are people bringing integrity to these conversations, or are they giving lip service to the kind of feel-good stuff that you're supposed to say when you're here?
I think we know the answer to that one, Donna.
I just wanted to put that on the table.
Yes, of course, like a lot of this is, like you said, this feel-good lip service. My hope, I guess kind of what I was trying to get at is my hope is that patient, like that persistence in pushing things from, again, the work of people who have worked in the criminal justice reform space for decades, been pushing it, and they finally get to the point where the Detroit Regional Chamber of Commerce thinks it's an issue that they need to address in a panel and a policy conference, that persistence. I guess my where I see hope here isn't that the chamber is addressing it. It's in the activists doing the work who have succeeded in moving this into the mainstream in this way. And it's not like, oh, thank goodness the business community gets it, now something will happen. It's the activists have pushed this long enough and then pushed the right buttons on this for long enough that folks are going to have to put it in their calculations somehow.
I hear you.
And that's where I'm hopeful. Now, am I like 100% that's going to happen? No, of course not. But am I hopeful that's what will happen? Yes. So there's it's complicated. I always kind of wrestle with like, how important is what happens here? Because there's a lot of like, they put out a report where it's like, whoa, here are the things that we did. And it's like,
okay.
Yeah. But it is a collection of, like you said, people who donate money to political campaigns, people who are employers, who control businesses and land and all kinds of other stuff. And so it is interesting what they're collectively thinking about. But what, I struggle with how to place this event every year. And I've struggled with that every year. It's not like something I've ever found a quick answer for.
No, I almost liked that column that you wrote. I almost liked it.
Oh, no.
I just didn't finish
get the Donna
I didn't finish reading it.
Oh, okay.
I didn't finish reading it. I've been busy. So
Okay.
I'm going to read it. I'm sure I'm going to like
Donna
it.
like.
Listen,
The coveted Donna
make it-
like.
Well, you're flattering me, and you're also making me feel like I'm too critical. But at the same time, I have to finish reading it. I like the direction you're going in. I think you're right. The inclusion of
Thank
these
you.
themes is important. My cynicism is not directed at you at all.
No, I appreciate that.
I
Thank
think
you.
that my cynicism is just directed at the way I see things seem to improve, like with police reform, and then we had more killings the year after than we had the year before. And it's like, there's this resistance, and I don't even know if the cynicism as much as fear or lack of clarity on how we translate all of these good conversations into meaningful action when we're off the island.
Yeah, no, exactly. I think yes, I can't add anything to that. That's right. Like how
That's the tension.
Yeah,
right?
that is the tension.
Yeah.
And there's a lot of power among the attendees here, and it's interesting. It's just really interesting to see and to be able to relate to folks who aren't able to be here. What's happening? It's just there's a lot of influence and power collected in this room, and we should all know kind of like how that's playing out, what people are thinking about. But it's an event that is it's not really easy to categorize or like ball up. And it's easy. People kind of eye roll about like, oh, these elites get together on an island, and yes, that's true. But it's not just that. Like it's a complicated week.
I like coming up here. I'll be honest with you. I like coming up here because I like to see people all together and talk to and all the conversations that take place. The sessions, the themes, but I like the people. And so it's good to see you because I see you online and everything. But to see you in person is always good. To hear from people who are really starting to take some of these things on is always good. I just hope that we get to the point where we move beyond mere conversation and start looking at our corporate partners and say, if you really do believe in the power of stop investing in people who don't.
Yeah, that's the thing I wrote the column about last year after seeing all the corporate logos of Pride is I'm really glad that businesses have decided that it's in their best interest to support LGBTQ rights. But I wish those same businesses had felt like they needed to speak out on abortion rights because there's a lot of women and, but yet somehow that one was controversial. But, we're I looked up the statistics on this. 2/3 of Americans believe that believed in Roe, that Roe was rightly decided and that women should have access to abortion. When the question is reframed as who should make the decision, a woman and her doctor, the government, blah, 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 it goes up 10 points to 74% people believe a woman and her doctor should make these sorts of decisions. 2/3 of Americans believe that racism is a problem and that racial violence and police brutality are problems. 2/3 of Americans believe that same-sex marriage is good. So these things all have roughly the same approval rating. There's 1/3 of people who are not they're very wrong-headed in this country. But 2/3 of people are consistently saying, but we've decided that some things are too controversial and some things are acceptable, and I want all those things to be things that are non-controversial, because civil rights, human rights, whether it's abortion rights, gay rights, anti-police brutality, anti-violence, our humanity is our humanity, and it should never be controversial to acknowledge our humanity and to support and bolster our humanity. And I'm extremely frustrated with businesses that decide to pick and choose when they're going to say that we get to be full humans.
Right.
It will never be controversial to bolster our humanity. That's a quotable.
It is absolutely quotable. When businesses are basing their contributions on these neoliberal principles that they want government to stay out of the business way, and that the primary, it feels to me like what some politicians can do is they can attach these pro-business ideals to these anti-humanity ideals in one piece of legislation. The businesses have to choose what's more important, my business interest or humanity. And when those things are, so you can't have my business interest and humanity coexist and have that be okay.
This is the same kind of thing that happens in the technology space, which is also a business space, is the folks who are at the forefront of the, tech, whatever, revolution. Like Twitter is, I'm sure you've heard this defense, is that Twitter is like, it's just technology. It's value neutral. It's like, well, but people are using your platform to spread hate and to harass people. And it's like, well, but that's not our fault. It's just a platform. But it's like that same thing. It's like, this is just a business decision. This isn't about, I shouldn't have to consider this because it's just a business decision. I want government to stay out of the way. It's like, but you don't want government to stay out of the way, like when it's about building a road to your business, or when it's about, the investments, the early government investments to build the internet, or having police and fire protection for your business. Like, then you're fine with the government intersecting with your business. But then when it's like, I don't know, I want a truly regulated system of capitalism that requires employer or corporations to bear the true cost of bringing a product to market, which means paying a living wage and not destroying the environment, then somehow that's overregulation or that's too much government. Wow. It's like it's not. It's like they want to pick and you can't pick and choose.
We want the government to regulate people, not business. We want business to be free, not necessarily people. Yeah, right. We want to invest in as a
right.
nation.
America.
I know what you meant. I was just being cute.
I agree with you. But as a nation, we want to invest in business. We believe subsidizing business is more humane than subsidizing
the American
individuals.
way.
But I want to say, I think maybe the solution to all of this is to bring back and enlarge the Black Panther Party, right? You want gun control? Let's give a whole bunch of black dudes guns and let them open carry and see how quickly you get gun control legislation passed. If you want to regulate Twitter,
that's dangerous because they killed the Black Panther. I get what you're saying.
I know you understand what I'm saying. And this is all said tongue in cheek because the reality is speech is free. Depending on who's saying it, okay? When you have some people, this hate speech, this speech has to be regulated. And the reality is Twitter would regulate some of the speech that is, that could be spoken by some black people. I mean, I am no fan. I used to be a fan of Kanye West. I used to be a big fan. College Dropout was my thing, okay? I loved that album. But the way that people came together to silence him and to say, this is unacceptable. He said things that other people have been saying all along and keep saying, and all of a sudden it became problematic when it came out of a black voice. When you have this man, I don't even know his name, who's posing with guns in strip clubs and whatever, and John Moran or whatever, and he lost his job. And I think it's ridiculous for me. I don't have a gun, and I'm a peaceful person. But how is him having a gun more... I don't understand. It feels as though somehow putting some of these powers or rights in the hands of black people is when they become problematic. And so as I look at Twitter saying, I can't do anything, when I look at people saying, well, guns are a human right or the American right, I always think that there's only certain populations you're willing to regulate these freedoms in. And that's the only way you're going to get those regulations through.
I don't know about the strip club gun guy.
You're talking about John Morant, the Memphis Grizzly Memphis Grizzlies player who flashed a gun on Instagram while he was in a club and then got in trouble, got suspended, and then just recently got in trouble again for having a gun on Instagram again. So he's going to be suspended again.
But the Kanye West thing, anti-Semitism is like dangerous and terrible and unacceptable. And to me, but I definitely agree with you about how different groups of people are policed when they say things. But to me, the answer isn't to say like, oh, Kanye should get a pass on this. And that's not what you're saying at all. But it's to bring the penalty for others up too.
But
right?
there's no penalty. If anybody says anything about black people, it could be the most inhumane, discriminatory thing. Slavery was a good thing. Who was it who said that slavery was good? The guy who was, I'm telling you who it was. It was the man who used to be, his father was the iconic Michigan football coach, and he was hired, and he lost his job in a day.
Shimmy Schembechler.
Shimmy Schembechler made some horrifically racist statements that they said were insensitive. That's the way they get described. When he said something about the black family was stronger under slavery than it is right now. How can that not cause those types of comments? You read comments like that, you have whole theories written about black inferiority.
Well,
you've had people write books about the inferiority of black people's intelligence, the inferiority of so many aspects. So when you look at those things and you look at anti-Semitism, hate is hate.
Absolutely, and
some hate is tolerated in our culture and some isn't.
I am 100% for not tolerating anti-black racism. I'm like that. To me, it's the penalty. This is what I'm talking about. Raises the penalty for anti-black racism. I don't think we should tolerate people who have that. I don't tolerate it.
The other thing is that Kanye West went on some show with a neo-Nazi, and he was the problem, not the neo-Nazi he went on with. And I guess my issue is the neo-Nazi has a platform. Kanye West was deplatformed on everything. Now, I am not a fan.
So you're talking about selective outrage.
I'm talking about the kind of selective outrage that says if a black person does it, it's a problem. If a white person does it, it's not a problem. I'm talking about the kind of selective outrage that would suggest that the anti-Semitism in our society is coming from black folks, and as if we're bombing synagogues, and it's not happening like that. And so I think that we need to have conversations around equal outrage and equal kinds of things where we don't let anybody get away with hateful behavior.
Yeah.
Nobody should be flashing guns in public. I don't believe people should have private firearms. I know that makes me a second Amendment person who's violating all of those principles, but I'm not at all in favor of Kanye's speech. I'm in favor of the fact that it's a problem when Kanye speaks it, and it's allowed to be spoken against other people and by other people.
So, I mean, here's the thing. It's pretty easy to go out and say awful things about women and be a total misogynist, and there's very little social penalty for that. So
right, exactly.
I am, like you said, hate is hate, and anti-Semitism, anti-black racism, misogyny, misogynoir, anti-immigrant hate is hate is hate, and it should all be unacceptable.
Anti-LGBTQ hate, anti-immigrant hate, anti-every kind of hate is wrong. And so I guess we need to live in a society where Twitter and other groups are willing to establish rules that don't allow for hate, period.
Yeah, I'm with you, man. This is deep. This is a deep conversation
it's always
on Thursday
deep
afternoon
on Authentically Detroit.
Yeah,
Nancy Kaffer, editorial page editor at the Detroit Free Press. We want to thank you for coming on the podcast for the first time. We're so happy to have you.
Yes, thank you.
I appreciate you. This is why I like talking to both you guys, because you keep me on my toes. And this is wonderful. Thank you so much for having me.
Our pleasure.
We really appreciate
love you.
Coming here. Thank you.